So today we're going to discuss about the Mrcp basis abdominal station, and I'm going to talk a bit about splenomegaly case. So let's move on to our scenario. So normally in the abdomen station, this is a 10-minute station. So you're not required to take any history from the patient. There'll be some command there that examine the abdomen, or there may be some other statement like patient is having abdominal pain, please proceed, or maybe the patient is having some weakness, or maybe some other clues. So in the abdominal station, you're going to start this station by entering the room, and then you're going to greet the patient. So you begin by introducing yourself and confirming the patient name. Hello, I am doctor, and I'll be your doctor today. Could you please confirm your name for me? Actually, this step may be not needed if you already know the patient name, or if you don't know the patient name, you may ask the patient name also. Then you explain the examination. So briefly explain the purpose of the examination. Something along the lines, today I'll be examining your abdomen, and my examination will consist of inspection, palpation, percussion, and listening to bowel sounds. In the examination steps, always remember to wash your hands, and you start by washing your hands or using hand sanitizer. Then the next step is to inspect the patient. So look at the general appearance, observe the patient general appearance for signs of any distress or jaundice, and also look closely at the abdomen to look for any abdominal distension, any visible pulsations or scar. Ask the patient to lie down comfortably on the examinal couch, and then you expose the abdomen. So expose the patient abdomen while ensuring their privacy and comfort. So you can say something like this: I need to expose your abdomen for the examination. I'll make sure you are comfortable and maintain your privacy. In the short stations and even in the consultation station, it is always a good practice to do the commentary. Whatever actions you are doing, the examination you are doing, maybe you can just do the commentary, explain the patient what you are doing. So it will be very helpful and it will create a good impression on the examiners. Then you're going, after you've done the exposure, then you're going to proceed with the palpation. You'll start with the light palpation first to assess for any tenderness, mass or guarding, and then you're going to do deep palpation to assess the size, consistency, and any tenderness of the spleen, and start away from the area of discomfort and then move systematically. Spleen measurements is done by bimanual technique. So use a bimanual technique for spleen measurement, with one hand supporting the patient back and the other feeling for the spleen. So as this is a case splenomegaly, so normally you will find the spleen on the abdominal examination, and please practice. And because if you miss this important sign, then the whole your case, it will be affected, and then you will be lost and maybe not be able to gain good marks in your abdomen station. Then you, after you look for spleen, then going to palpate for the liver, assess the liver by palpating for its lower border. You can say that to the patient, now I will check for the lower edge of your liver. This may feel a bit firm, but it shouldn't be painful. Assess for any shifting dullness, check for shifting dullness to evaluate for the ascites. I will now perform a quick test. To check for any fluid in your abdomen, and this involves tapping on your abdomen and listening for changes in sound. So better to explain the patient that now you're going to start the percussion. Percuss to assess for any dullness or resonance over the abdomen. I will use a tapping motion to listen for different sounds in the abdomen, and this helps me understand the distribution of organs and any potential issues. Maybe not that long, but you just can say, I will use a tapping motion to listen for different sounds in your abdomen. Then you proceed with the auscultation for ball sounds using the diaphragm, the stethoscope. So I like to listen to the abdomen with a stethoscope to hear any ball sounds, and this is a normal part of the examination. So once you have completed your abdominal examination, you're going to thank the patient for their cooperation. So you can say something like this: thank you for cooperation during the examination. You can now cover up, and I'll provide you with some privacy. Wash the hand, and this will be concluding your station. So this is all about the examination techniques. Now, when conducting an abdominal examination with splenomegaly, consider the positive clinical findings and the associated causes. Like if you found palpable spleen, always look for associated conditions like liver cirrhosis, CML, or myelofibrosis. So liver cirrhosis, normally if you got the spleen and you have other signs of the chronic liver disease or cirrhosis, like may have gynecomastia, may have striae, may have some Dupuytren's contracture, palmar erythema, clubbing, maybe parotid swelling in the alcoholic cirrhosis. So then you already have your diagnosis, and obviously going to palpate for the liver as well, that this patient splenomegaly is likely due to chronic liver disease. So if the spleen is smooth and firm, thinking they could be because of the chronic infections like tuberculosis, brucellosis, or HIV. If the spleen is irregular or nodular spleen, then you should be thinking about lymphomas, particularly Hodgkin's lymphoma, non-Hodgkin's lymphoma, or metastatic cancer. Tender spleen, normally you will not get tender spleen in the examination. However, just for the differential, because of the acute infections like infectious mononucleosis or bacterial endocarditis, and if you had a splenomegaly with associated lymphadenopathy, then think about lymphomas or other infections like HIV and tuberculosis. And if you found, along with splenomegaly, hepatomegaly as well, then associated conditions you'll be thinking about liver diseases like cirrhosis, hepatitis, and also think about some hematological disorders. Ascites, it is associated with cirrhosis and portal hypertension. If you find jaundice, it can be hemolytic anemias, it can be because of the liver disease. If you found any bone pain or tenderness, then you'll thinking about the hematological disorders like myelofibrosis or leukemia, and signs of chronic liver disease I already discussed. Fever, normally you will not get with fever, but just for the differential infectious causes or inflammatory conditions, and weight loss and fatigue, chronic infections, and malignancies. So these are some of the points which you should have in your mind when you're examining the spleen. So because your task is not just to find the spleen, because MRCP cases needs some more broader approach. So it means that you should try to look for any signs which could lead to the cause of the splenomegaly. Briefly about the differential diagnosis, splenomegaly, better to always divide the causes into different groups, easy to remember. So we'll talk about hematological disorders which can cause splenomegaly like CML, acute leukemias, both lymphoblastic and myeloid leukemias, and lymphomas like Hodgkin's and non-Hodgkin lymphoma, they can involve the spleen. Chronic infections, we're thinking about tuberculosis and brucellosis, autoimmune disorders like SLE or rheumatoid arthritis, and liver diseases like cirrhosis or hepatitis. Chronic hepatitis may lead to spleen enlargement. Okay, so hematological disorder, one group, chronic infections, autoimmune disorders, liver disease, hemolytic anemias like thalassemias, chronic hemolysis can contribute to splenomegaly. Sickle cell disease, splenic sequestration is a common complication. Inflammatory disorders like sarcoidosis and in rheumatoid arthritis. Metabolic disorders, Couch's disease, splenomegaly is a characteristic feature, and then there is Niemann-Pick disease. Infiltrative disorders like amyloidosis, amyloid deposit can affect the spleen. Hemochromatosis like iron overload may also result in organ enlargement. Neoplastic disorders, metastatic cancers, or myeloproliferative neoplasms, conditions like myelofibrosis, it can cause splenomegaly. Infections like malaria and congestive splenomegaly is another group, is portal hypertension, which increases the pressure in the portal system and can cause splenomegaly. Storage disorders like Gaucher's disease and trauma, splenic hematoma, trauma or injury may cause splenic enlargement. So these are quite a lot of differential diagnoses, but if you manage to remember 5 or 6, I think should be enough. Important one is not to miss is hematological disorders, chronic infections, autoimmune disorders, liver disease, hemolytic anemia, and inflammatory disorders. So how are you going to present this case? This is an abdominal station, so you're going to tell, today I have examined, if you know about the age, about the sex, just tell, examine, for example, today I have examined 60 years old male, and my examination findings are. So abdominal examination, inspection, if there's any visible abnormalities, you're going to tell about that. Palpation, if you find the spleen, you're going to say the patient has splenomegaly. Spleen size, measure in centimeter below the costal margin. Talk a bit about the consistency, any tenderness, percussion. Percussion note obviously will be dull, and auscultation, if any vascular sounds are heard or any splenic bruit is heard. So remember that in the short stations, like in this abdominal station, neurology station, if you think that you had the positive finding like spleen you have found, it's better to give your positive findings first, so that the examiner know that you have already picked up the sign in your clinical examination, that you have picked up the splenomegaly, and then you will proceed to describe about the important negative findings. So in the case presentation, you're going to talk first about the abdominal examination. You will say, we will confirm that you have found the spleen and patient has likely splenomegaly, and then you will talk about the differential diagnosis. So you can say something along the lines that the splenomegaly is present and my differential diagnosis include, or I'll be considering the following differential diagnosis. Again, repetitions, we have done it before: hematological disorders, chronic myeloid leukemia, myelofibrosis, infectious causes like infectious mononucleosis and malaria, inflammatory conditions like SLE, rheumatoid arthritis, and neoplastic etiologies like lymphomas or metastatic disease. And then you're going to talk about your investigations approach. You want to do some blood tests, CBC with peripheral smear, liver function tests, and serological tests for infectious causes to look for the cause of the splenomegaly. You can say something along the lines that I would like to do the following test. Imaging studies, abdominal ultrasound to confirm splenomegaly and assess its characteristics, CT scan or MRI for further evaluation, and hematological workup like bone marrow biopsy if hematological disorder is suspected, flow cytometry for lymphoma. So you're going to talk a bit about your provisional diagnosis, or based on the finding, the provisional diagnosis is whatever provisional diagnosis you have. Briefly about the management. If the examiner stop you here, it's okay. Otherwise, you will continue and you will talk about the management. So immediate measures: if pain or discomfort is present, analgesics may be administered, and consider referral to a hematologist for further evaluation. Further investigations are based on initial investigation. Further tests will guide the management plan, and the treatment options. Treatment will depend on the underlying cause. May include chemotherapy for hematological disorders, antibiotics for infections, or immunomodulatory agents for inflammatory conditions. And patient education is important. Explain the need for additional investigations, discuss the potential treatment options and potential outcomes, and emphasize the importance of regular follow-up. So this should be your approach, and as I have told you in my previous presentations also, once you're doing the case presentation, be systematic and don't stop until the examiner stops you and asks you other questions. Some of the important questions which you may come across in a case of splenomegaly: can you explain the differential diagnosis of splenomegaly? We have done it before. This is a very common question. So make note of it and try to memorize it. And when the examiner asks, be systematic and especially important, as I told you, divide into different categories. So differential diagnosis here I've written very briefly: hematological disorders like CML, infectious causes like infectious mononucleosis, inflammatory conditions such as SLE, or neoplastic etiologies including lymphomas. So these four categories are enough. What additional information would you gather from the patient history? So here's the model answer. I would inquire about symptoms like fatigue, weight loss, night sweats, and any history of recent infection or travel. Additionally, a detailed drug history, including any medication the patient is currently taking, would be important. How do you differentiate between hepatomegaly and splenomegaly on examination? This is a very common question. So hepatomegaly is typically associated with a firm, smooth liverage, while splenomegaly, they may have a palpable spleen tip and a notch. And then you can say that the position, because how are you going to start the palpation for the splenomegaly? Normally you're going to start on the right iliac region, and then you move upward to the left hypochondrium. And sometimes can be confusing. If it is a big spleen, then you may confuse it with the liver. So must know the difference between the hepatomegaly and splenomegaly. What blood test would you request for this patient? Again, repetition. You're going to do CBC with peripheral smear, liver function test, and serological tests for infectious causes such as mononucleosis. Why is an abdominal ultrasound useful in this case? So abdominal ultrasound is important because it helps confirms the presence of splenomegaly, assess its size, and evaluate the characteristics of the spleen and surrounding structures. How would you explain the provisional diagnosis to the patient? So there, one of the answers is I would use simple language to explain that based on the examination initial test, there is an enlargement of the spleen, and I would reassure the patient that further investigation will help determine the cause. What is the significance of bone marrow biopsy in this context? So bone marrow biopsy is indicated when there is a suspicion of a pathological disorders. It helps assess the bone marrow's cellular composition and aid in diagnosis of conditions like leukemia or myelofibrosis. What are the potential treatment options for splenomegaly? Treatment depends on the underlying cause. It may include chemotherapy for hematological disorders, antibiotic for infection, or immunomodulatory agents for inflammatory condition. How do you address a patient concern about potential outcome? So I would provide honest information about the need for further investigations, potential treatment options, and the importance of regular follow-up, emphasizing that a detailed management plan will be tailored based on specific diagnosis. So that's all about the splenomegaly. Hopefully I have covered almost everything here, and hopefully it will help you in your abdomen station. Thank you very much, and I'm going to see you in my next presentation.